Hi, I'm Trudgen from Hope for Health, and I want to talk to you today about one simple way that we can create change in remote Indigenous communities. That simple solution is relationships. And I'd like to thank all you guys out there that are joining us and supporting the Hope for Health program, particularly those guys who have joined the Hope for Health family and are regular contributors. We don't rely on any government funds at this point in time, so your contributions make a big difference to us. I want to share with you today some of the ways that we apply our methodology here in Arnhem Land to make a difference, and I want to talk to you about the situation, give you guys some more perspective about the situation that we're working in here in Arnhem Land. So you've probably heard a bit about the massive problems that are found in Indigenous communities. You're knowing about Hope for Health, you would of course know that there's a huge amount of chronic disease in this community, and that's associated with a really high death rate here. And the statistics show that 80% of that death rate is due to chronic disease and cancer, all preventable diseases. So Hope for Health works hard to change that, to make a difference in people's ability to manage their chronic diseases. You've got a bunch of other different programs operating in these remote communities, Indigenous communities, that are trying to impact other areas of what's going on here, and the other things that you might have heard about in the media. Overcrowding, the lack of housing, the lack of the local people to build houses for that matter, poor educational outcomes, drug abuse, and high crime rates, petrol sniffing. We can go on and talk about a whole bunch of different statistics that show the problem and the crisis that is easily observable in these Indigenous struggling communities. What is not so observable is what's really underlying all that. And one of the problems that I see is that a lot of programs are designed, and they're often designed from the perspective of, we just have to fix this problem and that problem and that problem and that problem. And if we target each specific problem, we're going to fix the whole problem. And that becomes a very managerial approach to creating change. So we have programs that are specifically designed to challenge attendance to schools, so that if they can get attendance up, education outcomes in theory will improve. The problem with things like that is if the program is run in the wrong way, it can actually be detrimental, because it can undermine or make worse the conditions that are actually causing all these problems. Warriors Org was set up to run the Hope for Health charity on the basis of the work that myself, my wife and my father have been doing for a long time. My father's history goes right back to the late 70s. And throughout the time we've been trying to pull together a clear understanding of what the fundamental cause of the crisis in Indigenous communities is. And when it comes down to it, that cause is intimately human. It's really about individual people's ability to control their lives, and then corporately for the whole community to be able to come together and control their community on their terms. And sometimes our desire to change the problems re-manifests that problem. So, trying to force parents to get kids to school when as a way of improving educational outcomes can increase the burden of and the stress on the family, and that can increase the sense of loss of control, and it can cause parents to give up and go and gamble and petrol sniff or whatever, or maybe just not care, and maybe just let the white fellas look after their kids. Maybe just give up, because the problem is ultimately about how a human is able to transform their world. In Hope for Health, the way that plays out is this. Basically, before Hope for Health existed, there was really almost no one in the community who, when they went to the store, was specifically making choices around how they can get the best food for their family and their kids to be healthy. So people were just buying whatever food they felt they wanted, or they felt that they needed, or they could afford, and it is really bad food. It's processed, it's lacking in nutrients, and it produces chronic disease. Sugar, flour, soft drinks, packet, takeaway food. These kind of foods are just the staple for the whole community. So junk food is a staple food in this community. Now, how can that be? The simple answer to it is that nobody really knew what good food was. Until we started talking about it, there would be hardly a person in the community who really believed that changing their food could make a difference. They had no way of knowing how to take control of their health and being confident about that. And confidence is really important, because you can't take control of your life on a whim. So if someone's told you, you should eat fruit and vegetables and that's what's going to make it better, it's really hard to convince yourself of committing to that, because you don't necessarily believe that that's going to be the case. You can't be sure. So the Hope for Health program targets that problem and puts people through a retreat so that they can be sure, they can experience food change in their life. But that's not the only reason the Hope for Health program works. That's the key practical reason why it works. It's that experiential educational model. But underlying that is a simple solution that can be applied anywhere, and it's good to keep in mind in trying to understand what is good development in these communities, and what kind of programs and organisations and ways of working in communities actually makes a difference. So if the problem is about control, whether that's getting the information you need to have control, whether that's being able to access a particular system of help, whether that's being able to unify and pool the resources to be able to unify a group to offer leadership or business, for example, all those things require something that's the same in all circumstances, and that is a good relationship. In order to find the resources you need to be able to form relationships with the right people, with the right organisations, and you need someone to draw on when you get into trouble. So Hope for Health is really built on that foundation, because the idea didn't come from my wife just thinking it up as someone trained as a medical professional in the community. It came out of a dialogue and a discussion and experience with someone who we had known for years, for a decade in fact. It was a decade before we got to this place where the Indigenous founder of the program, Diane, had this crisis. And in that crisis, as friends, we were aware of it and concerned. We were like, what can we do about this? What can we just keep her alive for another day, you know? But in offering help, we were actually able to enter into a dialogue about it, a ongoing dialogue. We'd already really been talking about it for years, and she'd been trying to find ways to change her circumstances. But this crisis for her, this health crisis for her, precipitated that. And the little bit of help from Karma just made that possible. So relationships started it, but relationships also is what creates the continuum of change and the multiplication effect that's happening in the community. So at the first stages, when Diane had this massive change, and you can read her story online if you like on our website, it's called Diane's Story. She had this massive change, and the community saw her go from being in a wheelchair to over 3 months being up and around and walking up and down hills and around the community. And you know, she would just, wherever she sat down with someone, she would just tell them about her story, and she'd start explaining about food and how there is a logical story about what good food is that's really grounded in their tradition. And this story would inspire people. And then the first people who came to us, my wife and I and Diane, to say, we want to do the same thing that you did, you know, they're the people that we already had close connection with after working in this community for 4 years. So the people we had the closest connection to were the ones that came first. And then it was their relationships that brought the next group, and then it's their relationships that brought the next group. And so we're moving from household to household, the family to family, through the relationships that exist. And the whole Yolngu world is built on family relationships, extended family. That's the structure of their society. Even their political structures work through the interrelationship of clans, of family groups. So we build on that. And it's a simple idea that what does relationship mean? We're talking about the relationship. What do we mean? We mean that you have sustainable relationships of support, accountability, and trust being maintained over time. It doesn't mean that the solution for this community is that every white fellow that comes has to have a best friend Aboriginal person. No, it means that they have accountable, supportive, and trustworthy relationships with a section of that community, and that can be through the work that they're doing. The opportunity in a program like Health for Health is to take that organic reality and just grow it. And that's our goal for now, is to continue to grow the relationship we have with our steering committee, with our participants, with our local workers who are training to be health coaches and key support to the community. I believe as we see that grow, we will see both the expansion of the program, but also the transformation of the community. I really think that's where the hope is for Hope for Health. It's the simple truth of relationship and partnership.